Good morning, everyone. Thank you for joining us. I'm Dr. Velasquez, Health Officer for Spokane County. I almost gave myself a different title today, but that was just one of those lapses in the brain. Now, today we're going to have a conversation about something that I think is very, very important to the community, and an anniversary, and a little bit of history, and a little bit of what the benefit is to the region. And I know I'm being very cryptic, but to my right, I actually have today the Executive Director of the University of Washington Gonzaga University Health Partnership, John Skloot, a dear friend, and to my right, Dr. Pollack, Harold Pollack, who among other things has about 17 titles, but he's the Chief of Medical Education for that program, and someone that has spent a lot of effort in medical education, graduate medical education in the region, so which is something that is very important to us. So thank you for coming here today. And since I already alluded to the partnership, obviously that's what we want to talk about today. But before we get to the partnership and what we're celebrating, I know that it's always important to give people a frame of reference, and the frame of reference is we do have a history in the community that I think is important to talk about for a couple of seconds. So I want to look to my right and let my colleague Dr. Pollack to maybe talk about that a little bit, and then we'll
Sure.
go to the partnership.
Well, thank you for having us today. I think it's a pleasure to be here and to talk a little bit about the partnership and the University of Washington School of Medicine. And I think we're just really proud of the fact that the University of Washington School of Medicine has been here in Spokane educating physicians for our region for over 50 years. And it's flown under the radar for quite some time, but this partnership with Gonzaga has really elevated it, made it more apparent the good work that we're doing. So I'm going to turn it over to John, let John talk about the partnership, and then I'll weigh back in if that's okay.
Absolutely. And again, thank you for having us, Dr. Velasquez. It's always a pleasure to be here with my friend and colleague, Daryl. So as Daryl referenced, I think it's really important to highlight that the University of Washington has been in Eastern Washington for over 50 years now, educating medical professionals. They work on a partnership model. It's actually a 5-state medical school program, and again, they work on a partnership model in each of those states. And in Eastern Washington, it was 10 years ago when our colleagues, Washington State University, determined to open their own medical school.
Right.
And the University of Washington, to their credit, remained committed to educating doctors in Eastern Washington,
Right.
But because of their partnership model, they needed a partner. And we started conversation with them about Gonzaga becoming a partner in this 5-state region. And Gonzaga, I hope, as most people know, has now over 135-year history of being a partner in the growth and health of our community. And this was another opportunity for Gonzaga to utilize our growing expertise in health sciences, our history in the region, and really become a partner to the University of Washington and really take an innovative approach to continuing medical education across that spectrum, not just physicians, but medical education across the spectrum.
Well, wonderful. And I want to move away from the talking points for a second and just mention something. Full disclosure, I'm on the Regional Advisory Board for the partnership. And the only reason why I bring that up is because as a community member, I'm actually very proud of what we've been able to accomplish. And I've had a front row seat to all of the activities. So I just want to say thank you because as we chat about it today, I think people will get a better perspective of what does that really mean. A couple of weeks ago, we actually had the dean of the school, dental school, here talking about the dental program. So let's go back to the partnership. So one of the things that we always talk about is the goal behind all of these expansions in health sciences education, medical education, is the fact that Eastern Washington, we did have some difficulties in access a few years ago, and it's still a little bit more complicated in some areas, like rural areas. From your perspective, how is the partnership addressing some of those issues and concerns?
Yeah, I'll take that one first. And I think it's really important to recognize that what we're at our core about is workforce development.
Right.
And we want to educate doctors here in the community, in the rural communities. And I think it's really important that we do that and embed them in the communities. The University of Washington has had ongoing rural programs for the last 20 years. And I think it's just remarkable to be able to send young medical students out to the communities. They'll spend up to 6 to 12 months in that community and getting to know the community, getting to know the physicians, getting to know the people, but then also getting to know the community needs. And the students actually are required to do a research project in that community and community-based projects based on a needs assessment, and that's really helped tremendously in terms of getting folks to see the benefits of living in a smaller community. And then it's so gratifying then to see our students go back and become leaders in those communities. And right now we're at a spot where we have former students who've gone back to their sites to become physicians there, and now they're taking students again. And so it's come full circle, and it's a lovely thing to do. And I think that from the partnership standpoint, our goal is to bring one of the best medical schools in the nation here locally, partnering with Gonzaga that's got such a rich history, and really look at the entire ecosystem now of beyond physicians. Look at dentistry, like you mentioned with Andre being here, looking at physician assistants. The nursing programs at Gonzaga have all grown. So it's just been a great ride.
I agree completely. And I think it's important, to highlight as you look at the course of the last decade. And Dr. Velasquez, I want to thank you for being part of an advisory board, because that's a really important component of the partnership, because it's not just a partnership between our two institutions, it's a partnership with our community. So you and the other members of the advisory board really bring that community voice to the partnership and how we operate and how we continue to expand and grow. And I think it's that kind of expansion that's really important and gets to your question about kind of access in particularly rural communities. And because of our location in Spokane and our commitment to this region, our nursing program has for decades been very engaged with rural communities. What this partnership has really allowed us to take advantage of is the momentum, the growth, the private and public investment in health sciences. Again, Gonzaga has for a very long time had our School of Nursing and Human Physiology. Right. Just a couple years ago, again, because of our institutional commitment, because of our community's commitment, we changed the name of that school to the School of Health Sciences, with creating an opportunity to expand our programs. And we have been able to do that. We now have a program in public health. We have a bachelor's degree in neuroscience. Our nursing program continues to grow, and as Daryl mentioned, our DNAP program, Doctor of Nurse Anesthesia Practice, which we operate in partnership with Providence, another really important community partner. We've been able to expand that program. And as the only such program in the state of Washington, and with the critical workforce need in that area, the fact that we're able to expand that program, again, kind of that's an extension of our commitment to our community.
Well, thank you. And actually, I was going to ask a little bit about that. So let me recap a couple of things that I think are very important. One, we use the word health sciences. And the reason why I use the word health sciences is because many times we just think about medical education, a very important component. Doctors are important, but so are all the
Everybody.
other professionals.
Yeah, can't do it alone.
You need to get them all, because for every physician, there's 7 to 9 other professionals that are part of that team, and that's how care is delivered. So it's not just about medical education, but also about the expansion of all the other services, which impacts the region very positively, because many of those folks end up staying here. And as we've talked in the past, we have gaps in nursing, we have gaps in therapy, we have a number of gaps that we're trying to address locally. I think that's number one. Number two, you mentioned at least a handful of collaborations. And I think from the community perspective, so we are always very supportive of collaborative efforts. There are areas where people have to compete a little bit. That keeps everybody moving forward. But collaboration is important because it's efficient, it's effective, and it's cost effective. And you typically get a better outcome, which I think is great. And Daryl mentioned the long history in many of the states that wouldn't have medical education without that partnership. I don't want to gloss over that, because I think it's a very important history of 50 years. I wasn't born yet, but they tell me that it's 50 years. Anyway, so why are you laughing? But I think it's very important to give that perspective, a look to our past, our present, and a look to our future as to what else we can do. Now, if I were to ask you, person out on the street says, well, tell me, how does this partnership make my community better, whatever that community might be? What would you say?
From my standpoint, it's all about the health of the community, and I don't think you can have healthy communities without having access to health care.
Right.
And so I think getting our graduates into those communities is important, our students and then our graduates. And then, as you mentioned, I'd like to highlight, you said you had Andre here, the UW School of Dentistry has a rural initiatives in dental education called the RIDE program.
Right.
And that program has just expanded to increase the great outreach into the rural communities. We've expanded our physician assistance program.
Okay.
So we're really growing that whole healthcare environment. But in addition to that, I think that's a great thing in collaborating with Gonzaga, both in the nursing realm, but also I think in the public health realm. I was talking earlier about our students doing community-based research in the community, but now that's being just amplified even greater by our partnership with Gonzaga and the public health folks being out there. And since we're at the regional health district, I think it's an important thing to mention. And then just the other thing is we can't, like you said, we can't do it alone. We have to do it with everybody in conjunction. And being co-located in our building, just adjacent to the Gonzaga campus at Trenton Hamilton, we have our human physiology students at Gonzaga, and I think just growing that whole ecosystem, getting people involved. You don't have to do medicine, you can do ultrasound, you can be a tech, you can be a physical therapist, you can be an occupational therapist, all kinds of healthcare things that we can do. And I think what I like to say is that, healthcare is really, we used to give lip service to it being a team sport, but it was more like a golf team, and now we're moving towards it being a volleyball team, so everybody's playing together.
Wonderful. And you mentioned the building, which is in and of itself an accomplishment, I would say. And if people haven't seen it, is if you take the ramp of the highway on Trent, there's this beautiful building that has a UWGU like right in front and right back, so you can see what it is. So that's another accomplishment, I think, for the community.
Yeah.
John.
Yeah, I was going to touch on a couple things. One, you highlighted the building,
Yep.
and we talk about sort of educating medical professionals sort of across that spectrum in different professions. I think one of the things that we certainly take pride in, and it's due to the partnership, is there is an anatomy suite in the building. And our undergraduate students at Gonzaga have access to that anatomy suite and are taught as part of their curriculum in certain programs by the University of Washington anatomists. That's a very unique opportunity for our students, but it also provides them with broad exposure to other potential health science avenues. I want to highlight one thing as well because of the uniqueness of this partnership. Obviously, that workforce development component, particularly in our rural areas, is integral to what we're doing and what is needed by our community, but it's also sort of who we're developing in those positions. And I want to highlight a couple programs. One, and again, this comes back to kind of Gonzaga's expertise, and one of the things we can bring to this partnership is faculty at the University of Washington School of Medicine partnered with faculty at Gonzaga School of Leadership Studies to create a leadership pathway as part of their curriculum. And this is just my language. Whether they know it or not, doctors who go to practice in rural communities are going to be seen as leaders in the community.
Yeah.
So education around leadership principles, education around leadership approach, that's a really integral part of that. Additionally, when we look at the kind of health science sector in our region and what a significant role it plays in our overall economic impact, we partnered again with the University of Washington School of Medicine and our School of Leadership Studies to create the certificate in healthcare leadership. And I know Daryl teaches in that. And I think that's an important thing to highlight, if I could look to you, Daryl, because that impacts the professionals we already have in this community that are in charge of this care.
Yeah, and I'll just say I think it's attacking the same problem at a different level. It's a workforce development, but then as we develop leaders, either emerging leaders or identified leaders, and give them more skills, they're going to be able to run their operations, their healthcare delivery systems in a much more efficient manner. And I think we all know what the healthcare environment looks like right now. So I think we're attacking it on different levels. And I guess the other thing that I'll add that we bring to the communities is I think really about health promotion and education. Just in September, we have an ongoing lecture series. And in September, we're bringing in another speaker who's going to talk about alternative and new therapies in mental health disorders. And I think bringing those sorts of things to the community, they're not medical talks, they're geared towards the layperson. And I think, they're just something that I think we can all take advantage of. And the more education we get, the more we're informed, the better off we're going to be.
Wonderful. And so I'm glad that you both expanded a little bit, because the more we talk, kind of like the more layers we uncover. And I think if we had an hour instead of 15 minutes, we probably could keep talking about other ripple benefits to the region, Eastern Washington in general, that are the result of that. And I do know that we do now train more medical students around here than probably anywhere else in the state. And I also know that the medical students that come here tend to prefer,
Yeah.
not to brag, but they tend to
No, it's an
prefer.
accomplishment.
And that's kudos to the community, because part of that is because when they come here, they feel welcome, they feel appreciated, and they really feel that they're having an impact in that community that they're sitting in, as opposed to just, I'm here deriving benefit from my education, but nothing else. And that's one of those intangible ripples that I think is important for us to understand. So if you see a medical student with your doctor, say hello. I've seen many of them. If you go to your doctor and your doctor hasn't had the opportunity to be one of the proctors or one of the instructors for our medical students, because they do need to rotate in pretty much in every area of medicine, I say, hey, have you thought about? Because many times we don't think about it when you're busy in practice. But most physicians that I've spoken with that have either a medical student, PA, or one of the other specialties, they actually enjoy it. Keeps you on your toes, gives you that vibrancy of the day, like, ooh, I have someone that is listening to me. I need to be on top of my game here. So I think it's one of those intangibles that we see, that we don't see, but it's important to the community.
And I'll go forward.
Yeah.
I'll go forward on that and even
Sure.
say, I think if you have, again, this is what I do every day, but I think that if you have a medical student plus your regular doctor, or a PA student, or a nurse practitioner student, I think you're going to get better care. The doctors, you're going to have more eyes on you. You're going to get more time with your providers. You're going to hear this. They're going to hear the story more than once. They're going to delve into it a little bit more. So I think you're going to get better care. And again, I couldn't agree more about encouraging physicians and others to take on learners in the medical environment. It is one of the crucial areas that we're working on, because we need more providers to educate our learners. But
Right. I think also an important point in that, and coming back to the partnership with the community, and Dr. Velasquez, what you said about the community, that students feeling welcome in this community, and the draw that is for medical students and other students in other disciplines. And it is, and Daryl knows these stats better than I do, but you're more likely to stay in the region in which you are trained. So when we talk about filling the workforce need in our community, and by expansion, kind of Eastern Washington writ large, the fact that we are training more medical doctors and other professionals in this region really benefits the region as a whole, because they are more likely to stay.
yeah.
Absolutely. Now, we've used the term workforce a couple of times. I want to emphasize that to folks that are listening, because over the next 10 years, and for the past 5 years or so at least, we've heard workforce as one of the challenges, universal. It's not just in Spokane, it's pretty much all over the nation. And the reason for that is we have the largest ever generation in the history of this country's retirement age, or has retired. Many of them are going to be retired over the next few years. So we need to make sure that we're addressing all of those components, and that we're addressing all of the components of the new ways to provide care, the new avenues to provide care, and that presupposes that you actually have the people that can do it. And that's where the workforce comes in. Very, very important. It's not just, how many people do you have? Is that we addressing the needs, and do we have the resources to do it appropriately? And I think with partnerships like this, our goal is to make sure that we're doing that, and we're doing it 100% of our ability. So any last message for the community before we depart today?
You know, I would just say one thing, and I think it's a little bit existential, if you will. So,
Curious.
so I just think it's really important that we look at this partnership, and you know, the partnership's 10 years old. I think we've done great things in the community, and we're going to continue to grow and do things in the community. But it's also a time when I look at this partnership and University of Washington and Gonzaga. When we first floated, that idea first got floated, people were like, what the heck? How are you going to do that? And look at what's happened as a result of it. And it just, in our times, it just brings me to a point of like, we should be looking to come together and do things people wouldn't expect us to do. And come united, and we can do so much more.
Right, and one of the terms that we like to use, and I think is a really important term, is mission alignment.
Yeah.
The mission of the institutions is aligned.
Right.
Yeah.
And it's aligned with our community needs and our community desires and our community mission. And as we've progressed through this 10 years, we enter every one of our conversations understanding that there's mission alignment and what our true focus needs to be, and that's serving our community.
Wonderful. So I think that's a great place to set a couple of parting thoughts. First of all, thank you for coming here today. Thank you for sharing with us a little bit more about the partnership. I think it is important for we as community members to know as much as possible, because as you pointed out, it's mission aligned with the needs of the community, and it's a very unique partnership in the country that I think others may be replicating elsewhere. But the goal of it was not to have a building. The goal of it was to address the needs of the region at multiple levels. And to do that, well, sometimes you end up with a beautiful building like that, but that wasn't the point. The point is, how do we better serve the region, and what do we need to do? And the commitment to, hey, let's build what we need to build so we can have the resources. And I think that's a wonderful thing for the community to know. So I want to say congratulations on the 10 years. Can't believe it's 10 years. I remember the first time I had a conversation about this with former President McCall, Thane and I. Time flies when you're having fun.
It has been fun.
So with that, I'm going to say, everybody, thank you for joining us today. Thank you to our partners. We'll bring them back in the future as we develop other avenues of addressing issues in the community. Stay safe, stay well, keep an eye on the AQI, or Air Quality Index. I'm using kind of technical terms here, because it's kind of smoky out there, and remember that that's not good for you. So with that, thank you for joining us today. Stay safe, stay well, and we'll see you again next week. Thank you.
All right. Thank you, Frank.
Thank you.